So why will you be told that you need a cleaning at the dentist? Does your hygienist pick up that spiky thing and go around your mouth calling out numbers 4, 7, 2, 8? Do you know what they mean? Well, I hope I can help you understand how important those numbers are and what you should do about them. Really, if you have plaque in any shape or form, build up as tartar or calculus, your dental hygienist is probably going to want to scrape it off your teeth. Why do they do this? Well, it lightens the burden of disease in your mouth. And that is the reason for the justification of dental cleanings. But what if you're like me and you have used xylitol, which actually eliminates plaque? I have no plaque bacteria. I have no plaque. Why would I want a dental cleaning? My teeth are covered with healthy biofilm. Your teeth may be the same if you've been using xylitol for 6 months or longer. So then I do not believe there is any advantage in a dental cleaning. As long as you haven't got pocketing, as long as there's no buildup of calculus, there is nothing going to happen at a dental cleaning that's of any benefit. And if you have a dry mouth, you may have trouble reconstituting the biofilm that is protective of your teeth. So when you go for a regular cleaning, I think it is very appropriate to ask your dentist, do I need a cleaning? I did this. I've done this with people, with hygienists who don't know who I am. And some of the really good hygienists have been wonderful and said, no, honestly, you don't need a cleaning. At which point I'm happy and I leave. So that's a regular cleaning. It's to get plaque or the fluffy bacterial mass that grows on some people's teeth that's called plaque, or calcified plaque and calculus off your teeth. And if you do lighten this burden, you will keep your mouth in somewhat healthier state. But it's not really healthy. And what happens eventually, if you keep needing cleanings, sooner or later you're going to get to the point, usually in your 30s or 40s, somewhere thereabouts, where you have something that they call a pocket. And your hygienist will be going around your mouth with a little spiky thing, measuring pockets, calling out numbers, 2, 4, 6, different numbers. In my opinion, anyone who has a pocket, and that would be anyone who has a pocket of 2 or 3 millimeters or higher, needs to do different oral care every single day. Every single day, the way you brush your teeth, the kind of toothbrush you use, what you're using to clean your teeth, I would change everything about what you're doing. Because to allow these pockets to be there is to allow harmful bacteria to live in this gap, this pocket between the tooth and the gum. And these bacteria that get in there, they're not plaque bacteria. It's plaque that may cause the gum to loosen in the first place. But it is these periodontal pathogens. They're opportunistic bacteria. I know that's a big word, but basically these are bacteria looking for the opportunity to find a dark, low oxygen space where they can grow between your tooth and the gum. And when they grow in there, they basically eat away at the attachment between your teeth and your gums. Nothing stops them. And they go on, creating pockets that get bigger and bigger and bigger. And basically the attachment of your tooth to the gum gets lower and lower and lower towards the root of your tooth, until eventually some teeth will fall out. Because the bone levels are always a set distance from the bottom of the pocket. So if your pocket is gradually getting deeper, you're hearing numbers like 6, 7, 8, you are bound to have bone loss occurring in the same time. And your dentist believes it's incurable. He believes there is nothing you can do to get rid of these bacteria. And the best thing that he can do for you is to periodically clean this space. As best they can, they will jet around with sprays, they will scrape and polish, and it's called root planing, and they will do everything they can to clean this pocket. But if this pocket is there, opportunistic bacteria live in your saliva. They are floating around in your mouth, just waiting for you to pay the bill, so they will go right back in there as soon as you leave the dental office and start their nasty work all over again. So these deep cleanings, as they're called, go on and on for the rest of your life. The first time you have one probably will be long. You may have to do it in quadrants. That's one side of your mouth at a time. And usually you're charged $100 or $200 each quadrant. So you can be paying up to $1,000 the first time to have all these areas of your mouth deep cleaned. And then, because it's not over, these bacteria will go back and start over again. You will have to go back every 3 or 4 months, and you may as well budget right now another $1,000 every year for these deep cleanings. The scary thing is that 50% of 30-year-olds have this kind of gum problem with pocketing. So if you've been told you have pockets, you're not alone. Don't ignore them. They're just going to get worse. And if you go back for deep cleaning, it's not going to go away. Now, I'm not opposed to deep cleaning if you want nothing to do with your mouth and you want somebody to do the best they can for you. Enjoy the rest of your life every 3 or 4 months at the dental office and budget accordingly. And they will keep you in the best health they can. And it is very dependent on the things that you do, because it's dependent on plaque. Do you have a lot of acidity in your mouth? Do you sip drinks all day long? Do you smoke cigarettes and dry your mouth? Anything that dries your mouth or makes it acidic will promote gum disease. It'll promote plaque and it will promote gum disease. Now, it could be simply that you are under a lot of stress, that dries your mouth, medications. You may be a mouth breather because you have allergies or sinus problems. There are all kinds of reasons, and I can't go through every single one. Simply to say, if you are told you need a deep cleaning, you need to make a decision. You either have to put yourself in the hands of your dental office and go for those cleanings, and they will keep you as healthy as they can. It's called maintenance. Or you could go home and use the strategies that I recommend to the letter. You have to use the exact products. They are over-the-counter products that you can buy in grocery stores in America very easily and on Amazon. And you use these strategies basically to eliminate plaque, to oxygenate these anaerobic spaces between your teeth so that these anaerobic, nasty periodontal pathogens don't like living there anymore, and they will disappear gradually. And it usually takes 12 to 24 weeks using my strategies, if you are a healthy person, to get rid of most of the pocketing in your mouth. So that if you were to do this for the next 3 to 6 months and then go back for an evaluation, there is a high probability, if you have followed my strategies, that you will be told, wow, you look good. Maybe you don't need a deep cleaning. Maybe you're fine. See you in 6 months. And that is how you can avoid this, by your own daily strategies. You must make a decision. When you're told that you have pocketing or periodontal disease or that you need a deep cleaning, this is serious. Don't ignore it. Don't think that your dentist is fooling you. You can take a test to find out, a salivary test. You spit into a test tube and measure the bacteria that you have in your mouth, and you can tell whether or not they're multiplying by the numbers that are in your saliva. So there is that test, and I do help people get that test if you want it, but never ignore it, because these bacteria are very bad actors. They can get into your bloodstream. They are associated with everything from Alzheimer's, dementia, heart problems, preterm birth, digestive problems, arthritis. Don't allow yourself to ignore. If you have been told you have pocketing, if you've been told you have periodontal disease, either let your dentist deal with it or you deal with it and get yourself to the point where you no longer have any evidence of any disease in your mouth. That's my wish for you, because then you will have truly achieved ultimate oral health.